Hello, everyone. Today is April 14th, 2020. And instead of bringing you a glossy magazine or 100 pages of local news, today we're going to have a real life, kind of real life conversation with someone on the front lines and one of our community leaders, Kyle Hansen, who's the administrator at Utah Valley Hospital. So Kyle, hello, how are you?
Hi, Jeanette. We're doing well. Thanks for having me on.
Good. I'm kind of guessing that the past month you haven't been sitting in your sweats watching Netflix like some.
No, not so much of that for me and our people working here. Obviously, it's been an unprecedented time, obviously for everybody, but certainly for those of us that work in a hospital setting. Just the amount of preparedness and how quickly things have changed and changed daily and hourly at times has made it really, quite challenging. And obviously, our goal and focus is we want to be there for our community. We want to be prepared to help those in need and not become overwhelmed. And so much of our work each day is really focused on that and on our plans to be ready for an increased load of patients.
Awesome. So what would I see right now? If I walked into the hospital, what would I observe? What would be the mood and what would I see?
So you would see what looks like a ghost town. And I say that mostly because, we've had to put in some pretty strict visitor restrictions. In essence, there really are no visitors allowed except for a few small exceptions. That's been really hard. We know it's really hard for our patients and their families and loved ones to have to experience that. And, everybody's anxiety is up right now, I think, and then to have a loved one in a hospital dealing with an illness and not being able to interact and be the support for them, I think is very challenging. And most people are understanding and frustrated, but it's very different because the halls are fairly empty without visitors and the public being inside. I think as you interacted with our caregivers, you'd find probably just the most committed group of individuals that you can find in our community. These people are just amazing in their resolve to be here when and if they're needed, and sometimes put themselves in harm's way. Certainly sooner than anybody else would probably in the community. But they are. I think the spirit's really good. We're obviously in an anticipatory phase, and we hope we don't ever have to use a lot of the plans that we put in place. But I think people are feeling really pretty good about where we're at and the readiness for what might come.
Awesome. Thank you for being prepared for all of us. I appreciate that. I've been watching the state numbers closely and every day seeing the updates. And in fact, they're going to be updating them any minute now for today. And Utah County has done well. I think just barely we became the county with the second highest numbers of cases, and we're the second biggest county. So for a while we were fourth and then third, and now we've become second. What can you tell us about the numbers that you have seen at Utah Valley Hospital?
Yeah, without disclosing any privacy, things obviously related to patients. I think we've seen a total of 18 hospitalizations in our county from the latest data I saw on the health department's website. The majority of those have been treated here at our hospital based on our own counts. And, I think at any given time, we've, flexed with the number of patients that are positive that we're treating, as well as the number that we call this acronym PUI, which is patients under investigation. Those are patients that have a test that's being tested, and we don't currently know if they're positive or not. We track those that information hourly, obviously, with who's coming in and who's discharging. And the majority of patients that we've had under a PUI status have been ruled out negative. In fact, I've been surprised by the numbers, how low they've been relative to the number of tests that we've run of people that have been sick enough to be in a hospital setting. So that's been good. Again, it's been so low that, with 18 hospitalizations across the entire county, that certainly doesn't overwhelm anybody. And the good thing about that is it's really allowed us to work our plans, our surge plans, and have time to work on retraining staff, nurses and physicians to work in other areas So that runway that we've had as the volumes really have been, relatively low in terms of those in the hospital has been a blessing for us to be able to kind of practice and model and train.
So it sounds like you've been using the time well, which is nice. We've heard a lot about the shortage of PPE and also even just testing. It feels like, the state's saying anyone with symptoms can get tested, but anecdotally people have found it difficult to get tested. Any thoughts on the supplies, PPE, but also the testing supplies from your perspective?
Yeah, I think from a healthcare worker standpoint on the supply side, again, we're acutely aware of what's going on in other places in our country and certainly nationally with shortages and the supply chain around the world obviously is in flux and has been disrupted and been very challenging. We've got a really good supply chain organization within Intermountain and have, I think, procured a decent amount of supplies. We've also been able to have a lot of community support. We've received locally here just in the county a number of donations and things of medical grade donations that we can accept. We've received some from nursing programs locally and other community organizations and coalitions that have helped bolster our local supply. And so, again, I don't know that you ever feel totally confident in that number because, if a surge comes, then you start to use that much faster. What I will say is, again, this time that we've had to prepare has allowed us to really creatively think of ways to address those problems. And I'll just give you a couple of quick examples. We're creating a process within our organization in Intermountain to start looking at how we would reprocess certain N95 masks so that they don't become single-use items that you throw away and then you burn through them so quickly. We're actually going to create a process to reprocess or re-sterilize those masks so that we can continue to use them multiple times and do that in a safe way. And so, again, this time that we've had has afforded us some luxury to look into how to create some things that will help us lengthen out the amount of supplies that we have, and again, hopefully that we don't ever have to use them in that way. But just a lot of local innovative thinking around how to do that, and then the support of the community has been tremendous. I think on the testing front, they have changed the approach in testing. It used to be 2 swabs for testing. Now it's 1, and that's certainly helping. And again, we're trying to be very judicious in our use of those testing swabs, and where we might have used them for other tests, look at maybe other options there so that we protect some of the supply for needs on the COVID side. But it is interesting because you're seeing some of the testing numbers come down in our state, which also correlates with fewer positive tests each day. And I hope that's not creating a false sense of security relative to where things are at if we're just not testing as much. And we've seen increases in testing sites as Silicon Slopes with the state and other partnerships have stood up additional sites, which has been great. But even at our 3 Intermountain testing sites in Utah County, we've seen testing numbers go down. So it will be interesting to see with the opening of the kind of the application, if you have any one of these symptoms, if more people will now get tested.
Right, and we actually have a show that shows those symptoms that are being looked at right now. That up. So if you have any of these symptoms, they're now asking you to come in and get tested. So, that is interesting. We've had increased testing sites, but lower test rates. Do you have any guess on why that might be? Is that because people are not seeking them out, or do you feel like there's been a bottleneck in people having access to them somehow?
I don't know if I have a good answer for that. I think the reality that there really isn't much of a defined treatment if you do test positive, other than sort of hunker down and like you treat a normal sort of cold or flu. If you're not, somebody in one of these risk categories that may have to seek out, higher levels of care. I'm not sure why that is. Why less people are being tested. The weather's started to warm up a little bit. Maybe some of the onset of symptoms is starting to die down a little bit. Not sure there. It will be interesting to see as we get into the warmer weather months what kind of transpires with testing. But hopefully, with the opening of kind of the restrictiveness of who qualifies to test, maybe more people will seek this out and help us increase the testing numbers.
I agree. I loved hearing the stories about what people in the community have done for you. What could people do? I'm sure there are people watching this or people who will read the summary of this who will want to help. Do you have ideas of ways people could get involved and meet some of your needs or lift the spirits of people there at the hospital?
Yeah, it's really been humbling just to experience the number of individuals and organizations that have reached out thinking of our caregivers and the work they're doing here and how can they support. We've had numerous donations of food from local restaurants, which the local restaurants are not really in a great spot to be giving donations at this time and worrying about their own business livelihood. And so that's been super impressive. I think this Project Protect initiative, which there's a website set up for Project Protect. This is a collaboration between Intermountain Healthcare, the U of U, and then LDS Charities to try and make it easier for people that want to help with the kind of the shortages of the protective equipment, the masks and whatnot, provide them a way to do that sort of meets the requirements that we have to use for medical grade needs. And so I think if there's people interested, there's a lot of sewers out there, obviously, and there's certainly a community need for masks that can be met. But from a hospital or healthcare standpoint, I would direct people to Project Protect. There's a great avenue there where materials will be provided to you with the template for how to make these, and they're medical grade materials. So we're going to have drop-off locations, I think, throughout the community, including one here at Utah Valley Hospital, where people will be able to make them to sort of the standards that we would need for healthcare workers, and then drop them off. We'll launder and clean them, and then distribute them throughout, our health system, the U of U, and potentially others. So I think that's a great way for folks to get involved in helping make sure we don't run out of these needed supplies as time goes on.
That's a great idea, and I've loved that website. And one of the great things that has come out of this pandemic is seeing so much collaboration and kindness. I know there have been health concerns, economic concerns, our way of life has been changed, but to see the kindness and collaboration, like you just mentioned, is really fantastic. Any last things you'd want the community to know about Utah Valley Hospital?
Well, and I don't think this is unique to us, but I guess I would say, we are open for business, and I understand the fear in the community around going near a hospital right now. We have tents set up on the outside of our emergency room, specifically to segregate patients that come in with any kind of a respiratory illness so that we can test and triage them in a separate environment from those that need care. But as an example, our emergency room is about half as busy as normal. And there are people out there we know that have other health conditions and things going on. And I think our fear or concern are people delaying needed care unnecessarily because of this fear. And what I would want them to know is we absolutely have ways to make sure we keep you protected and safe while you still seek out the care you need. And what we don't want is somebody avoiding care and then months down the road have a worsening of symptoms or outcome because they chose not to get the care that they needed. And I would also add, I think with a lot of our doctors' offices and things around the community, there's a lot of telehealth going on. So the ability to actually interact with the physician that you need to see, even if their office maybe currently isn't open, is available through many of those offices to connect through a video chat and make sure that you're doing okay. So I mean, we have stopped some things, obviously elective surgeries and some other elective testing, and that's been really statewide. So some of those things you can't obviously get done, but for needed care, we are here, we are open for business, and we have ways to keep you safe when you come in the hospital.
Awesome, thank you. That's great to set some fears aside and let people know they can come in and get the care that they need. That would be an additional tragedy if what you described happened and people didn't seek care. Well, Kyle,
Right.
thank you so much. And thank you for all the good work you and your staff are doing at Utah Valley Hospital. As one of the frontline responders, we all owe you a big, big thank you. So thanks for your time and all you're doing.
Thank you very much, Jeanette. It's been my pleasure.
All right, thank you.
Okay.
To the rest of you, we do daily, near daily updates of COVID-19 on UtahValley360.com. So check us out there. You can also find them on my Facebook page, Jeanette Bennett. We keep you updated on Utah versus Corona, and spoiler alert, we're going to win. As we leave here today, I want to share with you a meme that I hope is all of us come August here in the Utah Valley community. When we're getting back to normal, life resumes. We hope this is you, me, and all of us come August. Thanks, and we'll see you next time.